Hi, my name is Laura Johnston. I'm from North Carolina. First time I had breast cancer was 15 years ago, and I went the traditional route. I had a lumpectomy and radiation, and did pretty well for about 6 years, and then 6 years later in the other breast I got breast cancer and had a mastectomy and planned to go the traditional route, and the doctor told me all sorts of things that were very frightening. They were ready back then. They were talking about doing a bone marrow transplant and chemo, and it just, I come out of his office just terrified, really. And we decided that it was time to stop messing around and come down and see Dr. Rogers. We had heard of him right before my first breast cancer. A friend of mine had come down here, and she's been fine ever since, and that's 16 years for her now. So 8 years ago when I had it, I did have a mastectomy, but I turned around and came down here about 6 weeks afterwards. And I was here for a little while and had treatment, and I came back a couple other times in that first year. And it went ahead, it was gone. It was, I was real happy with it. In fact, the treatment was so much easier on my body than anything I anticipated with chemo or anything like that. That it was just a blessing. It was a real blessing to me. So I was fine for about 8 years, and then last year in May of 07 or April of 07, I had a mammogram, and it showed some trouble spots, and I had ultrasound and biopsy, and sure enough, it was in the left breast again, which was the first cancer I had, was in the left breast. And the doctor wanted to do chemo to shrink it, and then a mastectomy. And so about a week later, we headed down to Dr. Rogers because we didn't really want to go the route that the doctor up in North Carolina was pushing on me. And we were down here in May and had treatment for a while, and came back in October and had treatment, and I had a mammogram in February, and it showed that there were some things they questioned because they didn't understand treatment down here, but and there was some potential trouble spots. So I came back down, and I did have some spreading in that breast, and Dr. Reyes showed me where it was spreading. But I asked her about the spot that was treated last summer, and she looked at that spot on the ultrasound, and it's gone. So this is just a new occurrence here. But I'm just really, really thrilled with the fact that I can come down to see Dr. Rogers, and that I can have treatment for something that's so effective and it's so good for my body, not harmful to my body. And I'm just really thankful for that. And I've done very well. I haven't gotten the fix like you do from chemo and all that other stuff.
And did you have any concerns or worries about coming to St. Joseph Medical Center in the Del Rio area for treatment?
I had been to Brownsville before, so I knew a little bit what it was going to be like to go to clinic, but I had never been to Del Rio, so it was just a little different. I didn't have any concerns as far as my safety or anything.
Yeah.
I was just something different, that's all.
And everyone that calls in and inquires about the awesome alternative cancer treatment of Dr. Rogers and St. Joseph Medical Center want to know, they always want to know if you lost any hair or anything, and obviously you haven't lost any hair. And but they're always wanting to know things. But one thing I want you to leave the patients with on this video is, would you, if there's everybody that's watching out here at this video, the patients that might be watching, what would you say to them? What kind of advice would you give them that are facing cancer today?
Well, first of all, as a Christian, I would say if you are a Christian, you need to pray about it and get peace from it. And just, once you know the Lord's leading you a certain way, and even if you have a few dark times, it's still you're being led this way, and it's really the only way to keep going. But I would recommend it for anybody. But I have also seen people that are down here saying, "Oh, let's see, maybe it'll work, maybe it won't," and I don't think they'd give it 100%, and I think that makes a difference too. But I would highly recommend it. It's very it's just so much more
kinder to the body.
Yes, I was trying to think of the right word to use. It's so much more kind. It's more kind to the body. It doesn't like you said, I've got my hair, you know. I haven't been sick, and it's just wonderful. I heard a couple one time that was here saying that even if, and his wife was in bad shape, and he said, if my wife doesn't get better, at least her quality of life has been better. And that's a big thing, you know. It's a big thing. I think it would be a big thing to anybody.